Hello, welcome to Back and Neck Pain Relief. I'm Dr. Brian Dufresne. I'm the director and founder of Back and Neck Pain Relief. I'm going to tell you a little bit about myself and a little bit about this program that I developed over the last 20 years, which includes non-surgical spinal decompression. First, about myself. I have been in practice for nearly 40 years now, and I have a specialty in orthopedics. I am a diplomate of the International Academy of Neuromusculoskeletal Medicine, and I am nationally certified in the specialty of non-surgical spinal decompression. I have been using this procedure for nearly 20 years now. So let's talk a little bit about what is this type of program, what does it actually treat? There are many different types of conditions that respond very well to non-surgical spinal decompression when it is done correctly. So conditions that include neck pain, back pain, numbness down an arm, numbness down the leg. This could be from bulging disc, herniated disc, which is also known as a prolapse disc. Other conditions like facet arthritis, which is a breakdown in the joints of the spine. Other things would be things like types of stenosis, where the openings are getting narrow and the nerves are getting irritated and pinched in those areas. So there are a lot of conditions, and even patients who have already had neck and back surgery, most of the time they can still get non-surgical spinal decompression. So let's talk a little bit about the spine. So the spine, I'm going to get a model here. The spine is made of 24 vertebrae. So we have the top 7 vertebrae here, which is the cervical spine, the neck area. We have the ones at the bottom, which are the 5 vertebrae that make up the lumbar spine, and in between is the thoracic vertebra, 12 of those in there, okay? So in between these vertebrae, we have the discs, and these are the disc levels over here going up the spine. The disc is a very interesting structure. It's similar in anatomy. It kind of looks like a jelly donut, like it's rings of cartilage, and I'll show you a model here. So here we have the disc here in red, and it's like rings of cartilage, but inside of that disc is like a jelly-type material. That jelly-type material can herniate through tears or cracks in this disc. So I'm going to make a herniation on this disc so you can see what happens with that. Now you can see that bubble coming out. That can pinch the nerve right in here, causing arm or leg pain. And if you have little tears or breakdown throughout the disc, it'll flatten out. And the disc will just kind of spread out, just like I take a ball of clay and push down, and the clay has to go somewhere, right? So it's going to spread out this way. And that can cause problems as well. And that can irritate the nerves in these areas over here. It can also irritate these joints, these facet joints back over here. So there are a lot of things that can go wrong with the spine. And a lot of patients are ending up in the surgeon's office getting neck and back surgery. And you know, sometimes these things are necessary, but more often than not, they are not necessary. Our program is currently getting a 91% success rate. That means 91 people out of 100 can avoid neck or back surgery if they have this type of program done. So let's talk a little bit about what does decompression do. Well, let's take a look at this disc again. If we have a herniation in there, so let's make our herniation. There you can see it right there. Now that herniated disc right over here, if we create enough negative pressure inside that disc, by pulling that disc apart, you can see it can suck that herniation right back into the disc and reduce that and take the pressure off the nerve. Now, if that is done with the correct frequency of care, This can stimulate a healing response in that disc, and it can seal over and heal that defect. And guess what? Now the patient feels a whole much better than they were before. Numbness and tingling down the arm goes away, and they can get back to living life again. So that's what we do here at Back and Neck Pain Relief. Now, our program includes primarily the decompression, and decompression, by the way, is not just any regular traction. These tables have been researched for decades, and they are computer guided, because if we pull the disc too much, it can actually cause the muscles in the spine to pull back. If the muscles pull back, it can actually cause compression on the disc, and you will not get a decompression effect, and you will not get the best result. These tables have sensors in them, so we know exactly to the pound how much it's pulling. So do we need to pull at 40 pounds, 41 pounds, 42 pounds? Little bitty differences can make a big difference in pulling that disc and rehabilitating that disc to make it healthier again. So our program focuses on decompression, but there are other procedures that we often use. Things like SoftWave technology. SoftWave is, we have been doing this for about 3 years with SoftWave, and it has really enhanced our decompression program. SoftWave promotes a decrease in inflammation, an increase in circulation, and the third thing, which is the most important, is it activates your body's own stem cells. Therefore, we can get tissues that have not been healing to begin healing again. So we apply this SoftWave along with our decompression work to not only pull the disc back in, but to get the best healing possible and to get it done as quickly as possible. Other procedures that we may include would be things like laser therapy, a procedure called Matrix, which is a form of electroanalgesia for pain control. I also use dry needling in some of these cases. And then part of our program is also the strengthening and the rehab of the muscles around the neck or around the lower back to give stability. So this isn't just a recurring merry-go-round type of treatment. It's something that actually gets to the problem and then stabilizes it, so we get good long-term relief with our decompression program. So I'm going to be in with you in just a little bit. I'm going to do a consultation with you. If you brought in any MRIs or reports or whatever, I'll be going over that with you. And I'm going to do an evaluation. I'm going to check your range of motion. I'm going to check reflexes, different type of neurological things. And we're going to see, are you a good candidate for this program? Well, I hope you are, and I hope that I can help you with all of this. So I'll be in with you shortly.